So we are going to have 3 webinars. The first one today, in a moment I will talk about what we are going to talk today. And firstly, I wanted to remind you all that 2 days ago on December 3rd, it was the International Day of Persons with Disabilities. It was celebrated all around the globe. And this year, by chance, to our webinars, a global report on health equity for persons with disabilities was produced by the UN, and the Special International Committee was convened for that cause, which is very interesting, and it's really connected to what we are going to talk about today. First, I will talk about Beit Easy Shapiro. I will give a short introduction about us. And then I will show you some of the important examples of laws concerning disability, and I will explain why are they so important for people with disabilities and their rights. Then I will talk about barriers people with disabilities face. I will give you examples of actual barriers people with disabilities experience and the reasons for those barriers. At the end, I will talk generally about the basic principles of accessible medical services, and I will bring actual tips, which some of them were given by people with disabilities themselves. And at the end, as I said before, we will have time for questions. But first, I want to start with a short clip we have made at Beit Easy Shapiro.
אני שחר, אני בן 31.
שמי לירון ואני בן 24.
שמי דרור ואני בן 41.
שמי ליאור, בן 32.
קשה לי שלא נותנים לי את התשומת לב הראויה ומנפנפים אותי.
שהרופא מדבר אל אמא שלי במקום אליי.
קורו מצבים שהרופא לא בדיוק אמר לי מה הולך לקרות, וזה קצת הכניס אותי ללחץ.
אני לא רוצה שרחמו עליי רופאים, אני רוצה שתחסו אליי כמו כרגיל.
יהיו סבלנים, הכי חשוב.
חשוב לי לעבור את הטיפול בקצב שלי.
חשוב לי שהרופא ייקח אותי ברצינות וייתן לי את הכבוד שמגיע לי, כמו כל בן אדם.
שירות שווה בשבילי זה להרגיש כמו כולם.
שיתנו לי יחס אישי.
שייתנו לי את כל המידע שאני צריך.
שיקשיבו לי בזמן הטיפול.
לא לחכות בתור שעות.
שירות ששווה בשבילי זה שיראו אותי.
יש לי מגבלה, אבל אני בן אדם שווה בין שווים.
זכותי לקבל שירות כמו כולם.
אני שונה, אבל שווה כמו כולם.
So, what did we see here? We see people with different disabilities wanting to be like everyone else in society, demanding their rights and sending us a message. I am different, but I am equal like everyone else. Now, before I will start talking, I want you to be like empathic for those people and try to understand and entering their shoes, like we say in Hebrew. Try to think about the dilemma or the contradiction lots of people with disabilities living. On the one hand, they want to be able to be independent. They demand their independence. But on the other hand, they are dependent on some of them, or most of them are dependent on the other. They need help, but the basic principle we have to understand is that it's their rights, and I will talk about it later on, it's their right to demand and get this accessibility, independent, and it's our right to help them in doing so. I mean, we, the medical professions or professionals, it's an important role And it's our responsibility, as I said, to do whatever we can to make it happen. In this case, if we make it accessible, it means we make them equal. Few words about Beit Easy Shapiro. Easy Shapiro, the man, was a Zionist man who had immigrated to Israel from South Africa in the 70s with a glorious vision of building and developing community that would support and assist people with disabilities in Israel. That gave the inspiration to Beit Easy Shapiro. After his death, led by his daughter Naomi Stuchiner, his family founded Beit Easy Shapiro. Beit means the house of Easy Shapiro. Naomi awarded the Israeli Prize for Lifetime Achievement on 2020. For over 4 decades, Beit Easy Shapiro acts to promote the rights of people with disabilities in Israel, improve their quality of life and inclusion in the community. Beit Easy Shapiro has special consultative status with UN's Economic and Social Council since 2012. Understanding the importance of education and training as a driving force of social change, the Trump International Institute for Research and Continuing Education in Developmental Disabilities was founded at Beit Easy Shapiro in 1994. It is named after Willie and Celia Trump, philanthropic activist in Israel for many years, especially in the field of promoting education and excellence in Israel. By the way, there is no connection to Donald Trump, if you are wondering. And here we see this handsome guy. His name is Tom. Tom is a man with severe physical disability who uses eye gaze control technology to communicate with the environment. He is an activist, a writer, an advocate. Tom participated at our leadership group of young people who use augmentative and alternative communication, AAC, and attend a self-advocacy and future planning course at the age of 18. We put it here as an example for the things we do with people with disabilities, all kinds of disabilities. And here you can see Beit Easy Shapiro from above. It's a whole complex with schools and kindergartens and classes and treatment rooms. So I will start with the definition. Who are the people who is a person with disability? A person with physical, mental, or intellectual, including cognitive impairment, whether permanent or temporary, which substantially limits his functioning in one or more of the central spheres of life. It was taken from the Equal Right for People with Disabilities law in Israel from 1998. I want you to look at this definition. At the beginning, it is written a person. At the beginning of the definition, we see an important example for the use of people's first language. It is basic principle in disability studies, and whenever we talk about people with disabilities or any other minority. First of all, we talk about the person. Then we talk about other characteristics he or she has. Moreover, we see that the definition consists of several main components or aspects. First, the disability or the impairment, physical, mental, or intellectual. Then, the duration, whether permanent or temporary. Then we see the last component, which is the functioning, substantially limits his functioning in one or more central spheres of life. Now I want to continue to the UN definition. On the last 20-30 years, we see more and more countries that recognize the rights and that promote the integration and inclusion of people with disabilities in society. We see that unlike the Israeli definition, the UN defines the duration as long-term. It is also an important component in that definition because it means mostly people with chronic or permanent illness and not temporary. The definition is persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. It is taken from the Convention on the Rights of Persons with Disabilities from 2006. People with disabilities in Israel make up approximately 20% of the population in Israel. Same numbers all around the globe, more or less, 15, 16, some countries even more than 20s. There are people with disabilities in all age groups in Israel and of course in other countries. Most of them live within the community and some live in group homes. That depends in which country. It's not like the other things I was talking about. Some are more independent. People with disabilities are included in society, and some still maintain the separation systems for people with disabilities. It depends in which country it exists. These numbers may be surprising to many because disability may not always be physically apparent. What about people with invisible disabilities? On the last 2 decades, we see a growing body of knowledge and actions are being made which focuses on special characteristics of that population. And who are they? People with intellectual and or developmental disabilities, people with autism or ASD, and people with mental disabilities. I think it misses more invisible diseases like the ones you see down here in the slide, like Crohn's disease, fibromyalgia, and more, which, as I said, during the last 2 decades, they are more and more, they get more and more place and more people recognize them, usually or mainly professionals. The special challenge for professionals, medical professionals, is that they don't always have the necessary skills and knowledge to understand and to make the adaptations needed in order to provide services to people with invisible disabilities. On our second webinar, we will host Galia, who is a woman with an invisible disability. It will give us an actual illustration of what it's like to be a person with invisible disability. The term accessibility refers to creating an environment that enables or creates the ability for optimal participation and functioning. In our case, accessible medical services. Now let's see the definition of accessibility that was taken from the equal rights of people with disabilities I was talking previously about. Accessibility is the ability, note the decision to start with the word ability, not disability, to reach, to be mobile, and to be oriented, all kind of actions people with disabilities use, same like anyone else, to be oriented in place, to use and enjoy service, to receive information that is given or produced in a place or a service or in connection with them, to use given facilities and to participate in programs and activities that take place there, and all of these in an equal, dignified, independent, and safe manner. The purpose of the law, and I quote, to make people with disabilities equal, fight discrimination of people with disabilities and the stereotypes about them, eliminate the paternalistic approach toward them, and lead to their full inclusion in all spheres of life, while eliminating barriers by making the public domain and the services that they provide accessible. Now, I wanted to bring you this quote because I think it has all the things that I am going to speak about today in this webinar. It's actually bring them all together. And you can see here that all the word that has a line downward are all the actions I was talking about before, but also the way we have to give them treatment, to act in front of them, and to supply medical services to them. Now, quite similar purpose we see in the United Nations Conventions on the Rights of Persons with Disabilities. I will later on, in a minute, I will read what is written here, but I want to quote the United Nations purpose: to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities, and to promote respect for their inherent dignity. It is important, and it is connected to what's written here on the screen. The UN Convention on the Rights of Persons with Disabilities, ratified by Israel in 2012, outlines a vision and international standards for civil and social rights that people with disabilities are entitled to, whoever and wherever they are. Following its purpose, Article 25 of the Convention refers to standards of health for people with disabilities. State parties recognize that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. It is very important for us to remember that this is their equal right to consume and to receive medical assistance from us as professionals and help like anyone else. Hence, the approach must make the adjustment needed by them to receive this help as much as possible. Of course, in a way that we, the service providers, can do or make. To be more specific, what is required from us as health professionals is to provide care of the same quality as written here to persons with disabilities as to others, including raising awareness of the human rights, dignity, autonomy, and needs of persons with disabilities through training and promulgation of ethical standards for public and private healthcare. I'm going to talk now about the barriers people with disabilities face when receiving medical services. No less influential are environmental factors that may constitute barriers to the functioning of persons with disabilities. I will talk now about reasons for avoiding the use of medical services which are connected to medical staffs. Sorry, I was jumping on something. I will start first on the characteristics connected to the people with disabilities themselves. They frequently avoid medical services because of an anxiety over new service providers. Of course, it is because they're new, they don't know them, it makes them anxious, and it is scary to go to a new place and get a new, especially in, for instance, people with autism, concerned that professionals will doubt their words. They usually fear that professionals will think they're lying or won't believe their words or the way they speak about themselves or about their injuries, for instance. It was also found that past experiences, even in my thesis, my doctorate thesis, I found that past experiences, of course negative, also leads people with disabilities to avoid medical services. Professionals speaking with their caregivers instead of them. If you remember, we saw it on the short clip we saw earlier. It is a common mistake done by professionals, medical professionals, which I will talk about later on. Caregivers can be a companion or a staff member from their group home, for instance, a parent or a guardian, and so. Concerned that professionals won't know how to accommodate them appropriately. Fear that professionals will not know how to give them the necessary adjustments or the accessibility needed. I think it is connected to what I was talking on previously about the experiences they have. It is even more getting stronger when they had negative experiences. Then they fear that professionals won't know how to treat them, how to speak to them. So back to the no less influential are environmental factors that may constitute barriers to the functioning of persons with disability. I will talk now about reasons for avoiding the use of medical services which are connected to the medical staff. Access to medical care for people with disabilities can be fraught with obstacles for several reasons. Lack of relevant information and knowledge about medical issues of persons with disabilities. Studies have shown that medical staff lack of training in the field of disabilities exist and needed to be stronger and wider. Second, lack of relevant information, as I said. It's also something which professionals in the medical professions needs to widen their experience and their knowledge about people with disabilities, different disabilities, specifically about people like people with intellectual disability or people with ASD. Many studies from recent years show that medical staffs do not have the right tools to give treatments, many of them, to people with intellectual disabilities, for instance. Difficulties in carrying out medical appointment due to communication or behavioral issues of the person with disabilities. Now, this is something that medical staff or medical teams should learn, and today it was also found in many studies that medical staffs and medical services lack the experience or the knowledge how to treat and make a special communication when needed to people with specific disabilities that are connected or filled as communication. I will show you it later on. What do I mean with communication problems? And lack of a professional peer support or supervision for complicated medical condition. In order to provide an appropriate treatment and make the right professional decisions concerning our clients, we all need support and guidance sometimes, especially with complicated medical conditions. Many studies also has shown that medical teams and professionals lack supported decision-making and peer support, especially with people with intellectual disabilities, like I discovered in my research and other researchers. Not many professionals or medical professionals, not only doctors, don't have their guidance and peer support because they are not a lot, and many of them need this support, but they can't find it usually or many times in their professional environment. Avoiding the use of health services may lead to decrease in routine checkups, avoiding follow-ups and outcomes procedures for people with disabilities, decreasing preventative treatment like taking medicines or maintaining a healthy diet, medical undertreatment, and approaching the health system only when in critical condition. All of these may lead people with disabilities to living in some sort of a vicious cycle concerning their health condition. On the one hand, it worsens and requires more care and maintenance from them. And on the other hand, their reluctance and avoidance that lead to worsening of their health condition. This is really many times it leads to living in a vicious cycle, as I said. Now, what about people with invisible disabilities as health service recipients? As I said before, it's a special group in the world of people with disabilities that has its own unique characters. The definition is people with intellectual disabilities, autism or mental disabilities, and, as I said before, physical or eternal invisible conditions. They face additional challenges, like difficulties in understanding instructions and directions. For instance, a person with intellectual disability who does not understand medical instructions or can't find the doctor's room, because both are not given or written with simple language, he can find it or she can find it. Difficulties in planning, remembering, and carrying out required procedures. Also because the acquired procedures, are not understood, but in many other cases, because of difficulties with persistence and consistency. It is common in people with ADHD, for example. And because the lack of case manager or someone that will make sure that the instructions are followed. Stress due to the situation, which hinders cooperation with the staff, the ability to express thoughts, participate in ongoing conversation, concentrate, and behave appropriately in the context of the situation. These are all examples of social, behavioral, and cognitive difficulties people with invisible disabilities face, which in many cases are worsened, unfortunately, when they receive all kinds of medical procedures. We have to be aware of this, and we have to act accordingly. People with invisible disability being forced to talk about their disability. Sometimes we see people with invisible disability who have not yet come out of the closet, meaning they haven't told or revealed their disability to their social environment. In other cases, people with an invisible disability who are still going through an internal process of recognizing and understanding their disability. When meeting with medical professionals, especially, sometimes compel them to talk and even expand on their disability or on various symptoms that characterize it, accompany or caused by it. All this creates another unique difficulty for people with invisible disabilities, which might be related by us as medical professionals. An individual's ability to function is affected by his or her physical, sensory, visual, and auditory, intellectual, and mental abilities and characteristics. The following examples shown here are all different kinds of difficulties people with disabilities face on their daily lives. When receiving medical treatment or when meeting medical staff, in many cases, they serve as barriers. Potential barriers for the patient. Cognitive difficulties like memory, understanding time concepts, differentiating between cause and effect, are all common barriers to people with intellectual disabilities, for instance, when receiving medical treatment. Communication difficulties like self-expression, language speech, difficulty expressing oneself, exist in all kinds of people with disabilities. For instance, a person with ADHD. who can't focus or explain clearly what he or she suffering from, what is the medical problem he or she facing at the moment. Or, for instance, someone with an active psychosis who has headache or a broken limb and can't talk or describe it to the medical professional. Social difficulties, missing social cues that others understand, like cynicism and sarcasm used by professionals, which are hard to understand by people with autism, for instance. Or in other cases, difficulties in understanding when the meeting is finished. Many studies has shown this specific difficulty I was talking about, to know the limits of the medical procedure, the medical meeting, when it starts, when it ends, and sometimes by simple words, it's enough to just say, okay, we are finished by now, we can say goodbye. It helps a lot to people with all sorts of disabilities, like missing social cues. Organizational skills, slowness, difficulty in organization and planning, spatial awareness. These are all difficulties which can cause problems to people with disabilities in arriving or finding medical services, getting there on time, and bringing the requested medical materials like tests and recommendations, and so. As I said, all kinds of disabilities, people with disabilities experience all of them together, just one of them. It's all barriers they experience, and all those barriers were found in, as I said, previous studies. More barriers. Restlessness in constant motion, impulsiveness, overactive response to stimuli. We should bear in mind that it makes the life of the one who deals with it harder, not just the medical stuff. Try to understand this difficulty and be patient to it. Emotional difficulties, stress, confusion or fear, lack of trust, frustration from treatment by surroundings. Sometimes it is hard for medical professionals to decide which problem should be addressed first. We also see it a lot when a doctor say, okay, let's go back to the example I gave on someone with an active psychosis. Okay, first I address the psychosis, or first I address the headache or the broken limb? What do I do? So we see it puts the professionals, medical professionals, in many dilemmas while giving this treatment to people with disabilities. Obsessive behavior, preservation, repetitiveness, same here. Medical teams and services should learn and practice how to deal with situations like this. And fear of unfamiliar people, like I was talking before. I will talk now about principles of accessible service provision, the basic principles of it. Human dignity and privacy. Be tolerant, kind, respectful, and keep on an equal attitude when approaching or giving treatment to people with disabilities. Providing service within the community in the same way, same level of quality and comfort like all people in society. Accommodations in accordance with patient's wishes will be given only according to his or her wish, without the obligation to show a certificate or pay extra money. Maintain patient's independence as much as possible. If you remember when person with disability comes with a caregiver or with someone else, firstly, we should speak to him or her and try to maintain their independence as much as possible when giving instructions and we're talking about the disease or wherever it is in our medical treatment. Few tips given to us by people with disabilities. Identifying and recognizing barriers. You can't see my disability, but do make an effort to see me. It was said by Galia, which we will meet 2 days from now on our second webinar. And she demands that you will see her as a woman, not her disability. It's not her, you won't identify her by her disability. You should make an effort to see her and listen to what she suffered from. You can do it sometimes just with a few short questions that make the difference, bringing the client the feeling you are someone he or she can trust, showing a desire to help, an interest in the problem or the reason they came to see you. The person as the focal point of the conversation. I was talking about it earlier. If I decided to come without a caregiver, don't ask me where my mother is. Don't talk as if I am not here. Speak to me, listen to me, and don't speak to me as you would to a small child. Liron, man with autism. He was in the short clip I was showing you before. Don't patronize. Talk to the person with disability in an equal and as one who deserves to receive your service like anyone else. I think this is the main message to us as professionals when dealing or giving treatment to people with disabilities. Problems connected to communications and tips, more tips given by people with disabilities. Communication, language, and adapted language. If you're using humor, please make sure I understand you. I don't understand sarcasm. Everything is literal. So you have to bear this in mind, that they don't always understand hidden meanings, and if you're speaking to them about their disability or about medical instructions, you should say it clearly as it is without speaking about hidden meaning of the things you were talking about. Accessible explanation and confirmation of understanding. Sometimes doctors, for instance, speak really fast and I can't understand what they're saying to me. They use words I don't understand. Shachar, a person with disabilities. So we have to speak in a way that will be understood by the person with disability. We have to make sure he or she understands what we're saying. We have to use, sometimes we have to use a simple language. We have to try and use simple language. And if the person with disabilities is telling us, I understand what you're saying, it's okay, you can speak about diagnosis or stuff like that, we're getting to know the person with disability, we're getting to know along the process while giving it their treatment, we're getting to know them and to know how we should speak to them. And the next one, adapted environment and aids. Augmentative and alternative communication, AAC. It doesn't have to be AAC. Sometimes it can be spontaneous things we have in the office, pointing on medical tools at your office, using common office equipment, or showing the forms of and explaining about them, showing them what they're about to sign, whether it's a waiver form or any other form, explain about it shortly. This can help your client in understanding and cooperating with you while giving them treatment. And I will show you another short clip. The Dancing Doctor. Treating people with disabilities does not necessarily or must be hard always. Sometimes only they allow you to fool around and do funny things. You don't get any extras over it, but you got yourself a patient for life. Okay, I will open it.
דיסקו. עכשיו עוד מעט נתחיל לשיר.
So, as I said before, I think this doctor got himself a patient for life. Okay. Sorry for that. And some statistics I wanted to put before we continue on to the questions session. An estimated 50% of the world's populations have a disability. Disabilities come in various forms, and persons may have the disabilities at different points in their life, at birth or quite later in life, during education, or while in employment. The number of people with disabilities is expected to increase over the coming decades due to population aging, longer life expectancy, and an increasing number of injuries resulting from natural disasters, among other factors. Many people will experience a disability at some stage in their life. Specifically in the US, I wanted to show you something interesting I found. It's very accessible also. Thank you. Okay, now I wanted to know if you have some questions.
So right now we don't have any questions in the Q&A. If anyone has any questions, please go ahead and type them there now so that I can ask for you. Okay, so it appears that we don't have any questions. I see that you have the second session up if you want to go ahead and talk about that for a second.
On our next webinar?
Yes.
Okay, so on this Wednesday, we're going to meet Sivan and Galia, which are women with disabilities. Galia, I was talking about before, and Sivan, who has 2 kids with ASD or autism, and we will get many examples of the barriers and their daily lives when of course when going to get medical treatment for themselves or for their children, the things they see, the things they experience. It will be very interesting.
Okay, great. So in order to register for that webinar, you just go onto the Eventbrite page that you did for this one. You can select the dates. There are 2 additional webinars besides this one. We have one on the 7th, and the last one is on December 12th, I believe it is. Let me make sure and confirm that.
Yes.
Okay, yes, on December 12th.
Yes. Same hour.
Same hour, correct. So you can go ahead. We will be sending out emails with the information along with the availability to click on the flyer to register. If you know anyone else that would be interested in these type of webinar sessions, please pass it on. So if we don't have any other questions at this time, we're going to go ahead and end this webinar session. Thank you again, Dr. Stern. Great session.
Thank
We
you.
appreciate it. Oh, wait, hold on. You have questions. Sorry. I see 2 coming up. Okay, one is, are there any tools to explain the rights for disabilities?
You mean the rights for people with disabilities, I guess? Yes, of course, in the UN Convention on People with Disabilities from 2006, there's lots of information in the UN site. There you can get lots of information about people with disabilities, their characters, and of course, as you asked, their rights. Actually, it is very different from country to country. As I said earlier, some countries still have a long way to go. Some countries are in between, and some countries made really huge progress in the last 2 decades in concerning the rights of people with disabilities, like Israel, the US, and North Europe mainly, but not only.
So the next question is,
Yes.
can you address what a person can do when attending a doctor's appointment with a person with IDD who refuses what the doctor is saying?
Okay, so it depends in many characteristics of the person with IDD. It depends how severe it is, the IDD. You mean when they refuse to take the medicine, for instance? It depends. If it is a grown-up, then you can force them to do wherever the doctors say. If it is teenager or a kid, his parents will decide whether to take the medicine treatment, but you can't force anyone generally, especially people with disabilities, to go through any medical procedures if they don't want to. If they have a guardian, it's different and even more complicated, but sometimes the guardian can make the decision for them. Sometimes it's good, sometimes not. Sometimes they decide things that the person itself doesn't want to, and then there's a conflict between the person with disability and their guardian. And we see all sorts of during the last years, we see many alternatives to the guardianship status, which can give them more independence to people with disabilities to decide about their own life and of course about their medical treatment, whether they want it or not.
Okay, I'm not sure if you touched this point, but the person wrote again that the adult is refusing the medical issue or to receive it, the treatment or the medication.
Yes, yes. So I was talking about it. If it's a grown-up, you can force them to take, especially if they have if they don't have a guardian. If it is a kid, it's his parents' choice usually as his legal guardians.
All right, so do we have any other questions? You have time now to write it in the Q&A. Okay, that person says being a guardian does not help in this situation.
Yes, it is not always easy. Being a guardian is, I agree, it is not always easy. If you mean being a guardian and a parent, both are not always easy. But being a guardian for a grown-up, if it's someone, a person with intellectual disability or autism, it has a lot of responsibility. You have to understand you're taking on yourself, and you have to think twice before you're entering this role as a guardian. Of course, you have always to look on alternatives, because being a guardian or giving a guardian to someone with a disability is like the last choice we have to make. If he or she can be independent without the role of a guardian, it is better, and it is part of the things we have to do as medical professionals to let them be independent.